You're listening to Civic from the San Francisco Public Press. We've covered the overdose crisis in San Francisco extensively over the last few years. Today, we're talking to 3 reporters about what they've experienced while covering drug use, addiction, and treatment here in the city.
Harm reduction is an avenue towards treatment, whereas they said that harm reduction was devoid of treatment.
One of the biggest misconceptions that I hear from folks who are against harm reduction as an approach, they'll say that it's enabling.
Where we really need to get to is looking at people as complex and nuanced human beings. And when we reduce them to addicts or people who use drugs and people who don't deserve care, we're really erasing their humanity.
I'm Lila LaHood, and this is Civic. On this episode of Civic, we brought in Nuala Bishari from the San Francisco Chronicle, Sydney Johnson from KQED, and Sylvie Sturm, reporter and contributor for Civic and the San Francisco Public Press. We brought these reporters in for a special Civic Roundtable. We're here to talk about drug use in San Francisco. You've all been reporting on this for several years and through the pandemic. We want to talk about what you've learned, misconceptions, and what you think people need to know about this issue. So, Nuala, I'll start with you. What have you learned while reporting on drug use in San Francisco that has surprised you the most?
I mean, so much. I'm still learning all the time. But I remember when I first started reporting on drug use in 2018, so 6 years ago. And I was at SF Weekly at the time and started doing a story because I'd heard of somebody at City Hall who was carrying Narcan with them. And I thought, wow, that's so cool. You know, how great that just regular people are carrying Narcan and saving the lives of poor people who use drugs, which is still cool. But almost immediately, as soon as I started reporting that story, I learned that the majority of people who reverse overdoses are actually people who use drugs, and that there is an enormous network of care within the community that we don't often hear about or read about. And so that has always been a really interesting thing for me in San Francisco. We don't think of people who use drugs taking care of one another, but that is, in my experience, the primary place where care actually happens, where people are saving lives and learning how to take care of one another.
You have a personal experience with Narcan. Can you tell us a little bit about what happened?
Yeah, I was leaving the Chronicle building one afternoon, and right across the street on the steps of the old Mint, there was a woman who was very clearly overdosing. I could tell as soon as I crossed the street that something was seriously wrong. So I went up to her and shook her a little, tried to wake her up, and realized pretty quickly that she wasn't breathing. So there was only one other person who stopped, so I turned to him and said, please call 911, tell them that there's an overdose happening at 5th and Mission. So luckily I had Narcan with me. I've been carrying it everywhere I go since 2018, and so I found it in my bag and administered a dose. It's just a nasal spray, so I stuck it up her nose. And she wasn't coming round. It takes a few minutes for Narcan to stop working, and I was getting really worried. She was very gray and ashen. And so I gave her a couple of rescue breaths, like CPR, and a really firm sternum rub, which you can sometimes use pain to wake people up. But it just wasn't happening, and I was starting to get really scared. And so I pulled her into my lap, and luckily just then I heard sirens coming. I think it was just a few minutes between the call and when they arrived. And they showed up and were so kind and, not panicked at all, and administered some oxygen and managed to get her up and took her in an ambulance and took her away. But it was really shocking to me kind of how fast it all happened between me approaching her and realizing that she was in the process of dying and administering Narcan and emergency personnel arriving on the scene. It was just a few minutes. And I think about her a lot, and I think about if I hadn't stopped, what would have happened to her. When I had administered one dose of Narcan and she wasn't coming round, I yelled at the top of my lungs into the street, does anybody have any Narcan? And nobody did, and nobody stopped. And so I think that there is this kind of hardness that exists or unsuredness around people who use drugs in San Francisco. But we all need to learn a little bit more about saving their lives because people are dying on our streets in front of us every single day.
What an intense experience and something to be able to share with the community. I'm curious, what kind of responses did you hear from readers?
Oh, that was a really beautiful thing. My email inbox was just overflowing with people expressing such kindness. A lot of people asking me where to get trained to use Narcan. I think it really inspired a lot of people to carry it with them as well. There was one 81-year-old woman who messaged me and said, where can I go get trained for Narcan? So that was really great. And then a lot of people who had shared their stories of reversing an overdose on the street and how it felt for them as well.
Thank you for sharing that with us. Sydney, you've been reporting on this for quite some time as well. Can you tell us a little bit about how you got into this reporting? And then I'd love to hear about some of the personal stories that you've come across. I know you've done a lot of profiles within the community with people's experience with substance use.
I definitely want to echo what Nuala said about just still learning so much of this. And part of that is because the environment around drugs is always changing. But it's definitely something that I have had to come up to speed on, even having personal experiences and family members with touch points to this. I started covering overdoses and this public health crisis in about 2021. And that was when I was working at the San Francisco Examiner. I actually was an education reporter before this, and during the pandemic sort of got thrown into the public health beat and pretty quickly realized and learned that overdoses were far outpacing the number of deaths that we were seeing because of COVID, which was obviously still a huge disaster, but I think really put things into perspective for me. And having some personal experience with some of this, it just became something that I was really interested in diving deeper into. I think Nuala really touched on a good point about communities of care within drug-using communities and not sober communities too. One place that actually I have seen that a lot, which I think people tend to separate drug-using communities a little bit, is music festivals. I have seen at pretty much any large music festival that I've been to or have had friends go to, these are places that have been doing these types of caring for your community, looking out for one another for a long time, and have actually really, I don't want to say pioneered some of the harm reduction that has a history that goes back decades, but has mainstreamed it in a lot of ways, especially for younger communities. And so what that looks like is maybe at Coachella or smaller festivals too, there is a tent where if people are using drugs, and we know at festivals there's a lot of drug use usually, where people can go and get help. They're handing out Narcan. Test strips also is a huge part of that. It's interesting when I know we're going to get to some of these debates around harm reduction in this city, but it's so much bigger than just the politics in San Francisco. And I think it's worth zooming out sometimes and thinking about how Narcan in particular is a tool that literally saves lives. Like, we wouldn't politicize CPR, right? Like, but because Narcan is so associated with drugs and overdoses, it's almost become stigmatized in its own way. But it's literally a tool that can save lives. So I think that that is something that I have been interested in, is just like how we talk about drug users in like different ways and in different settings. Here in San Francisco, it's very apparent to me that much of the discussion around how we get a grip on our overdose crisis is often talking about people who are struggling with substance use disorder outdoors and people who don't have housing, which compounds those issues dramatically. But people who have housing are also using drugs and are much less likely to overdose because of it, because they're much less likely to use a loan and have access to health care. And I think, to go back to your original question, just kind of seeing how some of these structures are pretty intentionally built was pretty eye-opening for me.
So you've mentioned a little harm reduction. Sylvie, can I ask you to sort of give us an overview? When we talk about harm reduction, for people who don't know, what does that mean? What does it encompass? And why is it a philosophy that seems to be espoused by the Department of Public Health here, but also not universally supported?
Sure. So harm reduction is an approach to drug treatment that, as opposed to abstinence, it doesn't require total abstinence. It is an approach that allows people to, basically that meets people where they're at.
Harm reduction is literally just reducing harm, and it's something we do every day in our lives. Putting on a seatbelt is harm reduction. If we're at a bar and we know we're going to drive home, you can look and find out which beer has the lowest ABV, the lowest alcohol level, and you can choose to drink that beer so that you're not drunk when you leave. There are a million ways in which we practice harm reduction, but when it comes to people who use drugs, that can be anything like using clean needles so that you don't share infections or disease. It can be starting a drug regimen like buprenorphine, which can reduce cravings and help you kind of come off of drugs using some medication. It can be just learning how to use drugs safely, and so you're not getting abscesses. All sorts of things can be harm reduction. And so it's basically protecting people as much as is possible, depending on where they're at and what they're ready for, so that eventually you can maybe move them towards stopping using drugs or finding a healthier way to do it overall.
It sounds like harm reduction provides benefits to the individual. Are there also societal benefits to pursuing harm reduction? For San Francisco to say harm reduction is our strategy, how does that benefit the community?
I mean, there's a couple that come to mind for me. One is just larger public health benefits. Things like a clean needle exchange can really impact HIV rates and hepatitis rates, and that is like a huge influence on the community. If you can bring that down, that can have a lot of other health benefits too. So it's not even just about preventing overdose, although that's a huge component of it, but there's so many other public health issues that are associated with drug use as well that I think harm reduction can be used as an approach to deal with too.
One aspect of harm reduction is the housing first approach. So the housing first approach gives people who have a substance use disorder an opportunity to enter drug treatment programs into housing, but they don't have to maintain abstinence in order to retain their housing. And so they will be given all the wraparound services like mental health care, counseling, medical health care, and they will be given medical assistance treatment or buprenorphine, methadone, all sorts of things to allow them to maintain their mental health and physical health. If they do return to use, that will not necessarily mean that they will lose their housing. If they can maintain their behavioral health, they will be able to retain their housing, and that means that they will not be kicked out onto the street again. And that also is a good public health approach, because that means that you're not going to have people living on the streets. That's something that the public doesn't want to see.
To follow up on how important housing is as a method to reduce overdoses, which both of you have mentioned, the body is more prone to overdoses when you're sick, when you're cold, when you haven't slept. If you just think about all of the things that make your body more vulnerable, that increases the risk of overdose. Your body cannot handle opioids as well. And so you think about San Francisco, which gets a lot of rain. It's hard for people who sleep outdoors to get a good night of rest. People get sick. All of those are factors that actually contribute to overdose risk. And so when people are inside and they're warm and they have a place to sleep that feels safe, that can actually help prevent overdoses in the long term.
I think also there is a good amount of research about some of the social benefits of harm reduction policies. But I also hesitate to say, even though San Francisco has had this harm reduction philosophy on its books for, I think, a couple decades, or early 2000s maybe, they've had it for a while. We're not really doing a full-throated harm reduction approach here in San Francisco, or as far as I'm aware, anywhere in the United States. Public health and law enforcement are often opposing and not working together, even if they say they are. So when we look at places where harm reduction approaches have had a really large impact on society, like Lisbon, Portugal often gets pointed to, there you see not only some of these public health interventions, but also greater just cohesion with the healthcare system, with housing, with law enforcement, and really something that I don't think San Francisco has achieved yet.
When we hear about people here, whether politicians or others, being opposed to harm reduction, what is that about? What are they looking for instead?
Well, they'd be looking for total abstinence, but what they're presenting as harm reduction is not quite what harm reduction is. I mean, if you look at our current election, the campaign that they were putting forward through lobby groups like Together SF presented harm reduction as something that is completely devoid of treatment, and that wasn't the case at all. So harm reduction is an avenue towards treatment, whereas they said that harm reduction was devoid of treatment. So they're looking for a complete abstinence program, which for some people just doesn't work. I mean, one of the problems with complete abstinence is that it doesn't take into account that return to use or recidivism or relapse, as they say, is part of the process to getting healthier, to recovery from a substance use disorder. It could take years. It could take several return to use or relapses before you can have a 10-year recovery. People who are in the harm reduction space say that abstinence for some people is not realistic. So that's what they're not really taking into account.
Yeah, I think also one of the biggest misconceptions that I hear from folks who are against harm reduction as an approach, they'll say that it's enabling drug use. And in no example that I've come across has any harm reduction program been encouraging someone to use or frankly even telling someone like any direction of how to use, but literally just trying to engage with people, get them to think about their use, and really also just keep people alive and thinking about what they want their use to look like in the future, if they want it to change. But yeah, I think that enabling is really the issue that I hear people getting hung up on a lot. And that's just got to be one of the biggest misconceptions that I've come across.
Yeah, and to that point, I mean, last August I went to a rally at City Hall, and it was a rally organized by the San Francisco Union of Drug Users and people who were organizing a campaign to open an overdose prevention center here in San Francisco, which is a place where people could take drugs in a safe environment next to other people who would save them in case of overdose. And someone who went up to the podium to speak about the need for an overdose prevention center, he started his speech by saying that he was 10 years in recovery, and everybody cheered and cheered and cheered as though this was good news. And these were people who were in the Drug Users Union. They're not celebrating drug use. They're not enabling drug use. They just want to survive their substance use disorder.
They're acknowledging that it's something that is in their lives, or either currently in their lives or was in their lives, and just acknowledging the realities around it.
Correct.
Yeah, I think it's really interesting that in all the conversations we have in this city about drug use, there is very few inquiries into why people use drugs. And I think that is a really important question to be looking at the moment. Over my years of reporting on drug use and homelessness, I've heard so many reasons that seem really valid for people who use drugs. I talk to a lot of women who sleep outside at night and they're really scared. So they often use meth to stay up because it feels safer to be awake than asleep. I talked to a woman in a wheelchair who was going to that overdose prevention center almost every day who was in chronic pain and found that drugs helped her feel better. It was the only thing that worked. Prescriptions didn't help. I've talked to people who have schizophrenia who feel more in control when they take meth. They feel safer in themselves and they feel like they can manage their symptoms. And so once you start looking into the root causes, many of them are solvable and treatable. And that's, I think, where we really need to get to, is looking at people as complex and nuanced human beings. And when we reduce them to addicts or people who use drugs and people who don't deserve care, we're really erasing their humanity.
So opioid overdoses and overdose deaths in San Francisco continue to rise. And people primarily point to the spread of fentanyl, but we know that the drug supply is constantly evolving. What do our listeners need to know about fentanyl? And is it still the main problem, or is there something else on the horizon?
Definitely fentanyl is in a lot of drugs now. It's pretty hard talking to people who use drugs to find people who aren't consuming fentanyl, either accidentally or intentionally. I think people are using it intentionally. That is something that is not commonly thought about, but people do like fentanyl. It's a drug that makes them feel good. The difficulty with fentanyl is its potency and its strength, and fentanyl test strips are becoming far more widely available, which is great, but they don't test the potency of a drug. And if you're, for example, if you're testing Xanax, you could cut a piece of the Xanax and test it that might not have fentanyl in it. And so it's a difficult drug to navigate around, and I think there are a lot of problems in San Francisco with the unregulated supply of it. There has been an increased arrest of drug dealers in San Francisco, which everyone applauds as a way to address the overdose crisis. But when somebody is working with a specific dealer and using drugs from them, the supply is more constant and they're more aware of what they're taking. And when that dealer gets arrested and they have to go to a new one, there might be a different concentration of fentanyl in that drug. And so I think the unregulated aspect is a really serious one here. Other places in the world have a safe supply where someone can come in and take a drug where they know the dosage, it is consistent, and they can manage themselves using it that way. And so, yeah, that's one of the big risks of fentanyl in San Francisco.
Just to add to that, and San Francisco not only started increasing arrests of drug dealers, but also drug users. And there's a lot of research that points to how as soon as people who are addicted to drugs exit jails, their likelihood of overdosing is extremely high because they may go a few days, potentially weeks in jail. without something that they've become dependent on, use again when they leave, and their tolerance has changed, and it can really impact the risk of overdose.
One of the possible harm reduction solutions that we've heard talk about in various ways is safe consumption sites, or sometimes called supervised consumption sites or overdose prevention centers, to reduce deaths from overdose, lower public consumption, and give people connections to other resources and help without pushing treatment as it has to go in this direction. I know you've all reported on, at one point, San Francisco seemed excited to have one or more of these centers. And then the political will behind that seemed to evaporate. Could you talk a little bit about this?
Basically, my avenue for reporting on the drug epidemic in San Francisco began by looking at what I thought was going to be the imminent opening of overdose prevention centers in San Francisco. The Department of Public Health had a plan in place to open up, they said, a dozen wellness centers. It was going to be some, I thought, wellness centers that were going to include some overdose prevention centers. And I really, at the time, had no idea that it would be a distant memory about a year later. So during that reporting, I traveled to New York and visited an overdose prevention center there. And I was really moved. I mean, I knew the logistics of what an overdose prevention center was, which was you're a person who uses drugs, you enter a facility, looks very much like a clinic, you give a name, they have a space in the back where you can enter a cubicle, consume your drugs, and someone nearby will keep an eye on you to make sure that you're not overdosing. But what I didn't anticipate was just how much absolute love and caring there is for people who enter that space. And the reason for that is it's part of the healing process. As Nuala was talking about, people who are addicted to drugs are often very traumatized. They have serious, deep trauma in their history, and that's the reason that they've turned to illicit drugs. It's their coping mechanism. And people who are trying to keep people from dying of an overdose often recognize that what's needed to bring people into a healthier lives is to help them heal from that trauma. And so they're brought into this space to take their drugs in a safer way. In New York, they have a holistic healing center where they're given Reiki treatments and sound healing treatments. And I mean, these are people who were never treated like human beings, much less whole, holistic, just special human beings that are deserving of that kind of love and treatment. So it was incredibly moving for me to see these people being just embraced and treated with love and respect that way. It works. They've reversed over 1,000 overdoses so far. The executive director, Sam Rivera, talks about how many of the clients have returned to their families, have returned to jobs. I spoke to a client there who happened to be from San Francisco and now lives in New York. And he talks about how he lives a very normal, healthy life where he has a job, he has a girlfriend. He goes to this center to take his drugs and just go on with his day. So I just see it as being an answer to someone dealing with substance abuse disorder.
I think the arc of overdose prevention centers in San Francisco over the last 2 or 3 years is just such a fascinating and oftentimes frustrating case study of politics in San Francisco. I remember really clearly in the fall of 2021, downtown was still pretty dark from the early days of shelter in place. A lot of businesses were still closed. San Francisco was still very much opening up, quote unquote. And I think even more than we see right now, because there were just fewer people out and about, we saw homelessness and drug use really, really visibly and up close if you were downtown. San Francisco was getting a lot of bad press for this, as were other cities too. But San Francisco always punches a little bit above its weight in terms of its values and what it represents to the broader public. So it's definitely taking a lot of heat. And Mayor London Breed had a really splashy press conference. She said, "No more bullshit. terrorizing our city. I remember it clear as day. And with that announcement, she said that we're going to start changing things. We're going to have an emergency operation for the Tenderloin, which basically allowed the city to bypass certain approval laws to more quickly stand up some emergency responses to overdoses, since they were rising really quickly since 2018, really. 2020 at that point was the worst on record. And so as part of this emergency operation, the Department of Public Health opened up an overdose prevention center. It wasn't labeled as such at the time. What ended up happening was the Department of Public Health and a couple different community-based organizations, Health Right 360, Code Tenderloin, they came together to work in what became known as the Tenderloin Center. And this was located right in UN Plaza at Civic Center. This was one of the facilities like what you were just talking about. They allowed people to come in, use drugs that they brought themselves in a supervised place. There was some calm, quiet rooms for counseling. There, people could also sign up for housing, Medicare, social services, figure out how to get a license. You know, there were so many of these like real basic services that were going on there. Not to mention they had showers and laundry services, multiple meals a day. Like the idea was get people indoors and try to get people interested in the services that could be offered. There were 333 overdoses that were reversed at the Tenderloin Center that year. It was open for only 11 months. 0 overdoses ended in death there, which is pretty remarkable, but also tracks with overdose prevention centers across the world. They also have pretty similar rates. But as time went on and the center started getting some heat from outside media. Someone even attempted to like scale the wall and take photos. Pretty wild stuff. Local businesses started complaining about people lining down the street and just it frankly being pretty prominent in the middle of a public park, essentially. And the city said, you know, this was always meant to be temporary. It ended up closing at the end of the year with no plans to open any type of replacement. So you had hundreds of people that were going to this facility every day, whether they were just getting a cup of coffee or if they were having their life saved from a Narcan overdose reversal. They were pretty much told at the door one day that they couldn't come back the next. And I was there that day, maybe you were too, and it was pretty gutting. There were folks that were like, I don't know what I'm going to do. I have been coming here all year. And at that time, the city said that it was going to open these smaller wellness hubs, a little more discreet in other places around the city that could offer similar services. And that has never materialized.
I want to speak a little bit about the legacy of overdose prevention sites or supervised consumption sites, whatever you want to call them. This has been something that has been going on underground in San Francisco for decades. This is not a new concept. And across the world, it really has been proven to be an effective model. This is not a radical new proposal. It's existed in Switzerland and Portugal and Canada for many years with really, really positive results. But in San Francisco, you know, we talk about these big centers, which we really do need. We really do need kind of centralized overdose prevention sites. But I think that people are kind of ignoring that bathrooms in clinics are often unofficial overdose prevention sites where people know that people are going in there to use drugs and are checking on them and have Narcan. That has been something, again, going back to community care, that has been going on for a long time in San Francisco in different ways. And we saw that after the overdose prevention site shut down in UN Plaza. On Overdose Prevention Day last year, Sydney and I were actually both in an alley in the Tenderloin where a group of activists held a pop-up overdose prevention site, and they walked around the neighborhood and told people what they were doing. It was unsanctioned by the city. It was questionably legal. But even just in walking around the neighborhood, people were excited about it. They showed up and they used in a tent, and there were people on hand to reverse overdoses. And while I was there, just over the span of a few hours, there were 2 overdoses reversed by that crew within a 1-block radius, 2 lives that were saved. And so I think it really speaks to how community has been doing this for a long time. And while we do need political will and we do need money and we do need places and we do need these things to happen, they're going to continue in small ways in San Francisco every single day.
Yeah. I'd like to point out, too, that I spoke to Hillary Ronan about that pop-up overdose prevention center, and she was there, actually, to support the effort. But she did point out that they're not a good substitute for an official overdose prevention center because they don't have those wraparound services that will connect you to housing or medical care or other counseling services. So it's a beautiful way for the community to step up when the city is falling short, but the city still needs to step up.
Yeah.
I think almost all of our reporters in some way or another are touching on reporting that has to do with concerns about public safety getting worse. And we often hear calls for cleaning up the streets that conflate homelessness and untreated mental health issues, drug use, drug dealing, and other criminal activity. But even public health experts and even police will tell you that it's not all the same people and it's not all overlapping, even though there may be some underlying truths in people with dual diagnoses. But some of the mythology around this just persists. Are there things that the city is doing or not doing that is keeping these myths inflated? Or why do conversations continue to happen in the same way that connect all of these issues that may need to be addressed in very distinct, discrete ways?
I think perception is a really hard thing to battle. We see that with crime rates in San Francisco. Even though they're down, people still perceive them to be really high. And I think the same thing happens when someone is walking down Market Street and sees someone who's homeless. There is this conflation that that person might be mentally ill or that they use drugs. There is a lot of fairly legitimate fear in this city, right? Like people are scared of people who are screaming in the middle of the street having a mental health crisis. That is a very real situation that is happening, but I do think that those things are conflated in part because media conflates them. The headlines don't help, especially the more right-wing headlines that we see on Fox News. San Francisco does have a terrible reputation right now, and I think all of those things are lumped together by a lot of media organizations as a sign of San Francisco's failings, that it has become too left and permitted too much. And here is the evidence. And they show a photo of somebody who's in crisis on our streets. So I think it's both. I think that there is a genuine fear on behalf of many people in the city of extreme signs of poverty and of drug use. And then I think the media helps conflate those into a broader perception of kind of terror, honestly.
Let's talk about Proposition F and what happened in our most recent election.
So Proposition F just passed in our recent election here in San Francisco. And what this will do is it will essentially require people who are on cash assistance through the County of San Francisco to undergo drug screening if they're suspected to have some sort of substance use issue. And if they are found to have that they will be mandated to go to treatment, I believe. And so this is actually something that when I have spoken to healthcare providers who were opposed to this, they said that some of the unintended consequences may be that people will actually hide their use, which could increase their risk not only of use but of overdose, but also that they may be less likely to even ask for cash assistance, which can be literally a lifeline when you're talking about food or taking care of someone else in your household, and can really entrench other challenges that cash assistance is intended to support.
I think this is going to be a really interesting thing to see how it's implemented. The Human Services Agency is in charge of handing out benefits. They're not a public health agency. They haven't done anything quite like this before. And I talked to some employees when I was researching this for the Chronicle about the screening process, and I didn't know this, but a lot of the screenings actually happen over the phone. And so when you think about those moments, how are you going to assess if somebody uses drugs by talking to them over the phone, or even when they show up in person? A lot of people who use drugs are really skilled at hiding their use. And so I worry about the potential racist interpretations of this, how it's going to be, how the screening is going to work. And I will say that a recent Chronicle article that talked about people who were cited for drug use mentioned that there were 141 people cited for drug use in San Francisco who were receiving cash assistance who lived outside the county. And so when you think about that, the Human Services Agency is not even doing the most basic first thing in screening people, which is ensuring that they live in San Francisco, that there is holes in the system already with that. And so when you think about them screening people for drugs, I am not sure how this is going to go. And I think one of the other really serious risks of this is that if people don't comply with treatment because they relapse, because there isn't any treatment available in San Francisco, then they could lose their housing. You know, this is a benefit that gets a lot of people indoors. And so there is a risk of people actually becoming homeless through this measure that I don't think is being taken very seriously.
It's important to point out that this is limited to people under the age of 65 who are single with no dependent children, just to point that out. There are so many questions that remain around this measure that people still have. It seemed to be something that came around very quickly, that really was kind of like not very well organized. And so there are a lot of questions that remain. And one of them is for those who refuse or decline to be screened, they will be able to have their welfare benefits paid directly to a landlord if they are housed for 30 days. And the question that came up was, if that payment goes directly to the landlord, is that going to alert the landlord that this person is a person who uses drugs? And if the landlord is then alerted that this person is a person who uses drugs, will that cause the landlord to now evict this person as a drug user? Like, there are privacy issues around here. That's one question that came up. There's also the idea that, is this going to elevate crime? People are going to lose their benefits. So is this going to cause people to be desperate for that little bit of money that they now no longer have? And then there's an alternative to taking money away from people, which is, and we have seen programs like this in other cities, which is actually paying people to enter drug treatment. So instead of a punitive approach, you have an approach that will reward people to enter drug treatment. So you can try and assess the cost benefit to that. Will it cost more to take funds away from people? There's going to be an elevated cost to doing this program where you're taking benefits away from people. So you can try and see if it's actually going to be a beneficial cost to pay people to enter drug treatment.
Yeah. People build this as a tough love sort of approach, but even in a hypothetical scenario where, say, someone is screened, agrees to go to treatment, the city still significantly lacks the amount of treatment and housing that would be necessary to really achieve whatever the end goal of this measure is. San Francisco has been adding more treatment options for people who are interested in recovery, but we're just still so far from meeting the demand. So the question is really like, well, where will people go? What kind of treatment? What does that actually mean? And then, of course, the concerns about what does this look like for other benefits that they may be associated with, I think, is a huge concern for people. You know, something that also comes to mind to me, I've taken a look at programs like contingency management, which is this idea where people will get a small stipend, maybe a gift card, some sort of reward for showing up to a group meeting or counseling and staying sober, showing a drug test that was clean, or frankly also just meeting their personal goals around drug use. It might not be complete abstinence. And those programs are pretty successful. There's some here in San Francisco, but they're all across the country. The difference is those are not taking away people's cash assistance for things like food and housing. It's giving them a little carrot to show up. And then the idea is, okay, can you build a community here? Can you meet other people with like-minded goals? Can you show up again and again and really try to invest in this type of change? With Prop F, critics will say you're punishing people for being honest.
And we've seen Trent Rohr, the executive director of the Human Services Agency, we've seen him recently say that he has changed lanes a little bit by entering this space of drug policy where he has never done before. And that made me wonder, where is the head of the Department of Public Health, Grant Colfax, in all of this? We haven't heard from him at all. Why does Trent Rohr need to change lanes? Where is Grant Colfax in all this? That's just a question I've had.
I think it really speaks to the city's lack of desire and ability to work together. We talk about Portugal, where all of the different city departments are aligned in their goals, that the police are working with the public health department, that there is a lot of consistency in approach and a shared vision, and San Francisco is nowhere near that. Like, our Department of Public Health are working on things that are completely in opposition to what the police are doing. The fire department is kind of its own entity at this point. Yeah, and now we have the latest example of the Human Services Agency. And I think we're never going to address this crisis effectively if every single department and politician in the city is trying to do something different. There has to be a cohesive investment in services for people, or else we're never going to make a dent in any of this.
I think unlike other health issues, I mean, we saw a lot of politicization over COVID, but you look at almost any other major public health issue, it's not as politicized as drug use is. And that's not unique to San Francisco, but it's definitely really potent here.
Looking at San Francisco versus what's happening on a national scale, are things any different here, or is it just that the spotlight is on San Francisco because people like to look at San Francisco?
You know, one place that I've been watching quite a bit is Oregon. 3 years ago, Oregon made waves as a state to really embrace drug decriminalization. But similar to kind of what we're seeing here in San Francisco, there wasn't a whole systems-wide approach. So you had some lesser punishments for people who were caught with small amounts of drugs, but you didn't see the same type of investment that you saw in maybe Lisbon, Portugal, in terms of building out treatment centers or overdose prevention centers and all of these other step points along the way of someone's recovery. So decriminalization is really important for thinking about the criminal justice angle and jails that are overcrowded and people that are cycling in and out. But that's just one component of, I think, a much larger comprehensive approach to drugs. And now what we're seeing actually is Oregon is attempting to revert that decriminalization bill. Just very recently, the state passed, governor still has to sign it, basically a bill that would reintroduce some of those punishments for even minor possession of substances.
I think San Francisco in many ways is farther along in the conversation than the rest of the country. I think a lot of people don't know that certain states don't allow needle exchanges. Idaho 2 days ago just decided to ban them after one of their needle exchanges was raided by police. And so I think that we do have a significant investment from the Department of Public Health into harm reduction efforts and into really, really successful programs in the city. But at the same time, the politics are not aligning with that. And when you look at where we're going politically as a city, I do worry that we are heading into territory that is just really far away from the science.
I look at Vancouver, British Columbia all the time because that's where I'm from. I'm from Canada, and I've spent a lot of time in Vancouver. And as a journalism student in the early 2000s, I observed a drug epidemic and saw the opening of the first overdose prevention center in North America and what it did to completely transform the downtown east side, which is very, very similar to the Tenderloin. The transformation of the downtown east side was a good news story. And then fentanyl hit. Then you saw a real spike in overdose deaths in British Columbia, in Vancouver, just like you did across the United States. What didn't happen was a narrative that an overdose prevention center and harm reduction was not working. You saw the Vancouver Coastal Health, you saw the medical authorities up there talk about how fentanyl was dangerous. And they started prescribing heroin and other drugs to people with substance use disorder in order to save lives. So they expanded their harm reduction. But what they're doing up there, they're not sort of clamping down on harm reduction. They're sort of expanding it. So that's what I'm paying attention to.
If you look at what's happening here in San Francisco, what new thing do you see ahead of us in 2024 that gives you hope? Or is there an organization or a program or a policy that you think, hey, they've got something here. I think if we expand this, this could help a lot of people. Is there any one that you would point to?
I think the return of the Drug Users Union after a few years of not having one has been really revolutionary. I think it's really empowering for people who use drugs to have a space and community. I hope that there's a lot of activism coming out of there that really can center the experiences of people who use drugs.
I have been really encouraged by some of the efforts to get Narcan in schools and other public facilities, libraries. I think it's one of those things where the drug supply is really dangerous right now, and that's not going to change overnight. So as much as we can get people comfortable with talking about this and knowing how to save a life, how to use Narcan, that seems like a really powerful tool that can't be understated right now.
I was able to report on a program that's going through some of the supported housing buildings in San Francisco where some organizations are entering there and they're training the residents as leaders in overdose reversal. Not only is that saving lives because some of the residents there are emergency respondents, but it's actually providing them with some sense of leadership and some sense of self-worth where perhaps they're, again, recovering from trauma, or they themselves are still dealing with their own substance use disorders. Now they're feeling like they're adding to and having a sense of community with each other. So that's given me a sense of hope.
I do think that everybody can save a life in this city. I think it's a really difficult thing to see our overdose numbers just get higher and higher every year. This seems like an intractable problem. I think there's a lot of empathy and a lot of fear around it. But people who use drugs are just people, and I think it's on us as residents to take care of one another. And there is a very vulnerable population out there who's dying, and we can all carry Narcan and really make a difference.
Proposition F has a contingent where it provides guaranteed shelter bed for 30 days for people who are not housed. And that's cold comfort. I went on a weekend tour with a street outreach worker the other day. So we went and talked to a lot of people who were living in tents in the Mission and outer areas. And their description of shelters was pretty terrible. I mean, they don't feel safe. The staff that they've had interactions with, they don't feel respected. I mean, it's not a terrific job. I don't want to disparage the staff, but the idea that you have a guaranteed shelter for 30 days does not sound like it's an attractive offer for a lot of people who are unhoused. They'd rather live in a tent. And then to get housing, you have to be in a shelter for 3 months, some people have told me. So it's not an easy thing to get housing. And some of these people have told me that they cannot get into drug treatment. They will not get into drug treatment. They will not quit drugs until they're in housing. So you see the impossible situation that they're in. So I just want to put it out there that getting into shelter is not the answer for a lot of people.
The only other thing that I would want to add is addiction and trauma are incredibly personal, but this is not an individual issue in a lot of cases. And I think that's why when we think of just arresting someone as a solution, like it ignores family history, it ignores housing, it ignores, was there a death recently? There's so much that can go into these experiences that lead people to use drugs. And yeah, I think that to Nuala's point, we are responsible to take care of our neighbors in this city. And this is not just an individual issue, but it's something that is affecting everyone because in a way, we all are kind of part of this issue.
Thanks to our guests, Nuala Bishari from the San Francisco Chronicle, Sydney Johnson from KQED, and our own reporter and contributor, Sylvie Sturm. As drug use in San Francisco remains a contentious topic and overdose deaths continue to rise, we expect to see more reporting from these journalists. I'm Lila LaHood, and you've been listening to Civic. Civic comes to you from KSFP-LP 102.5 FM in San Francisco, a project of the San Francisco Public Press. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes producer Liana Wilcox and KSFP program director Mel Baker. Cynthia Chavez is our vocal coach. KSFP is a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find this episode, the companion article, and all our reporting at sfpublicpress.org. Reporters and Civic contributors include Sylvie Sturm, Madison Alvarado, Zhe Wu, Jessica Prado, and Michael Stoll. Civic airs Tuesdays and Thursdays at 8 a.m. and 6 p.m. on KSFP. New episodes on Thursdays. Thanks for listening.